But I can, even if you do come...
Adults you're working with, mate.
Yes. That's
Do you know what? I wanted you not to open that until it started. I really wanted you to wait until it started. You start doing your introduction, open it up, and then oh, fuck.
That's a weird looking penis.
Yeah, I was doing it from the angle.
It's
though,
kind of like
so,
half penis, half Venus flytrap, mate. Says a lot about you, right?
Yeah, it does, yeah.
Right, I'm just going to go straight into this and see if I can nail it first time.
Do it.
All right. Welcome to the Everyday Perspective podcast. Today we're talking men's health with Dr. Will Duffin, aka Dr. Will from the TV show Survivor. When not on set, Will is also an NHS GP, joint medical director at World Extreme Medicine, a medical educator, and active father of 2 young boys. Quite a schedule there, Will. Thanks for making the time for us, mate.
Thanks for having me.
No, absolute pleasure. And it's obviously such a massive topic, men's health, to chat through. So can't wait to get stuck in. Before we do, though, we've got to ask, the Survivor TV show, World Extreme Medicine. Tell us a little bit about that.
Yes, I mean, as you said, my main job is a jobbing NHS GP. I'm based in Exeter in Devon. But I kind of developed this strange side hustle in reality TV. I kind of, to this day, still don't quite know how that happened. I always thought I'd do something perhaps more praiseworthy with my life. I'd go out and help refugees and crisis and disaster victims. Yeah. But I ended up doing something even more worthwhile, which is making great entertainment for the American public.
How many seasons are they on now?
Well, I'm going out to shoot season 46 in May.
46.
Yes.
So successful then.
It's the longest running reality show in history.
Whoa.
Yeah. But
Is it really?
Yeah.
Wow,
yeah.
okay.
It's crazy. But it's an interesting role as a medic. Obviously, I'm there looking after the contestants and the crew. And there's a team of 8 of us actually.
Okay.
But I'm the along with my colleague Joe, Dr. Joe. Mm-hmm. Together we're the kind of on shoot docs. So we are kind of picking up the pieces when they're doing their challenges. So kind of running on set during the challenges and doing lots of kind of emergency care in front of camera. And you've got this kind of Hollywood level film kind of crew around you. There's 40 different cameras just pointing different directions. They've got cameras on boom arms and cameras. They've got a helicopter over you and all this stuff. And it's quite high stakes, high pressure stuff. You've got a sick contestant just kind of flat out unconscious on some beach in the middle of nowhere, and it's like you've got to step up and kind of get it done.
Yeah, on camera as well. Wow.
It's a great gig because it's a tropical paradise.
Where's it to? Where's it shot to? Sorry,
it's out in the South Pacific. I can't say the exact location.
Are you not allowed to? No,
I can't. Not allowed to say that, but it is in the South Pacific. Okay. So it's like the tropical paradise.
Is it?
It's amazing.
Is it like a little holiday for you?
It kind of, yeah.
How long do you go out there for at a time?
So our whole family and I went out last year for 9 weeks to shoot, which was cool. And then this year I'm just going out for 5 weeks. But yeah, it's not your average kind of gig that you'd get as a.
How did you get into that? Like, how does that come about?
Everyone asks this. Like, how do you kind of? Life's weird. It kind of spins you off in different directions sometimes, doesn't it? I always did medicine. I became a doctor because it's a real ticket to ride. It opens doors to loads of different avenues and opportunities. And I've always liked travel and adventure. And I just saw this job just advertised actually on, I think it was Facebook or something. And I went to a selection weekend. This was back in 2017, and just went, and one thing leads to the next, and you kind of go from there. So before doing this, I was doing medical cover for commercial treks and cycle challenges.
Yeah, right, okay.
So kind of Great Wall of China, Kilimanjaro, Machu Picchu and Everest Base Camp, that kind of thing. So there's companies that send tourists to have these experiences, and they all need medics to
so you would go along with them and
so I go along, look after the group, provide medical care for them, and get a kind of free ticket to go along and have that experience. So that's how I kind of cut my teeth and learnt the skills of providing medical care in unconventional environments, outside of the usual setting, and I just kind of went from there. So that's my side hustle. That's my kind of passion project. Keeps me going, keeps me energized, as well as being a coalface NHS GP.
Yeah. Okay. Wow. So it's quite a contrast, isn't it, between the two?
Very much. Yeah.
Yeah. How does it compare, sort of working in that environment and that sort of with that amount of pressure to then being in your GP practice?
Well, do you know what? the current kind of climate that we're in with healthcare in the NHS, there's never not any pressure, to be honest. And the pressure is kind of part of the job.
Yeah.
Where does the pressure come from? Does it come from above or is it from the patients?
Both directions.
Yeah.
That's a really interesting question, actually. I think, accessing GPs from a patient perspective at the moment, I think is really hard. I think there's long waits. It's a really difficult time to be a patient.
Yeah.
And I know particularly before the pandemic, all appointments are face-to-face. So now I was trying to deal with complex problems in 10-minute appointments.
Yeah.
And you've probably been to see the GP and had to wait, 30, 40 minutes at times. Have you got that experience?
Yeah.
And
even recently, yeah.
It's awful as a patient, right? To be sat there and waiting.
My surgery at the moment shut down. Completely shut down for 6 weeks because they got no one to staff it.
Yeah.
So then we've had to go to a different surgery. And then I had a little issue and couldn't get through, and then eventually got an emergency appointment to a surgery completely across the city.
Yeah.
You know what I mean? And that process though took 5 days, and I had breathing problems as an asthmatic.
Yeah.
So it's like something that's obviously not ideal, but at the same time, it's good from your perspective to see, what's happening your end.
Yeah. I really feel for, because the thing is, when I see someone like you who's been kept waiting for that long is waited 3 weeks to get that appointment, and then they're 40 minutes in the waiting room to see the doctor who's already running behind, and perhaps they're not able to address all of your problems, and you feel like you're being kind of hurried out the door because they're thinking about the other 4 people that are still waiting alongside you. It's just a recipe for that. That's what I'm talking about when I say kind of pressure. It's just the volume of the workload, and the complexity's gone up as well, and the resources with which to do the job has been diminishing. So I think the whole health system, but particularly primary care at the moment, is under a lot of strain, and I think that's affecting everyone.
So I know COVID gets a lot of blame for this sort of stuff, but was this happening before COVID, and then COVID has just made things worse, and then that's become like a bit of a blame game with that sort of stuff, or is that just, you know what I mean?
Yeah, I think
because you can't see people face to face as much, and then there's like phone calls. Is that where is our healthcare going? Do you think it's going more? Are we ever going to go back to regular face to face? You know what I mean? Or is it going to go more? Telephone calls, e-consultations. All that type of stuff.
It's a really interesting question, Danny. I think they say never waste a crisis, and yes, COVID was a massive challenge for the health service, but there has been huge development and innovation as a result. And one of those is a shift away from face-to-face towards other methods of seeing patients, namely video and telephone. Yeah. And that has released a lot of capacity in the system. And a lot of patients like having easier contact through phone, not having to travel to the surgery. Definitely. And I think that works for a lot of people. So actually now we've got a much more hybrid system. I'm doing a lot more telephone than face-to-face. You lose something over the phone. There's a lot of patients where that's not the right thing for, so you still need the face-to-face option, but a lot of GPs now are doing a lot more telephone work, and actually that does enable them to see more patients. It's convenient for a lot of patients, so there is positives as well.
Do you get the same time slot for that, if that makes sense? Like, so say you've got X amount of people waiting, and then do you have like a system where they'll say, you've got 6 telephone phone calls, or is it?
Yeah, well, this is the thing for me. I prefer it because I don't have 10-minute slots with people in the waiting room waiting to come in and see me. It's a lot freer. I can see patients in whatever order I see fit. So I see the most acute, complex problems first. I ring them up on the phone, and then I'll maybe bring them in if I need to. But I have a lot less people sat in the waiting room just twiddling their thumbs this way. And I have the more freedom to give the certain patients more time, particularly for mental health. Those consultations are the ones that really need 20, 25 minutes. Yeah, whereas, you have a cough or a cold, you can deal with that much faster. So it's built in a lot more maneuverability in how we work as GPs. And I think there's a lot of positives that come out of COVID in how primary care works and patients' experience of it.
Yeah, no, that's an interesting point. And I find that with even just jobs and stuff as well, it's opened up different opportunities now where you can kind of work in a hybrid way that you may not have been able to do previously. So I think that across the board is really, really interesting. Yeah. So in regard to, I guess, health of the nation, do you think there's a bit of a gender gap when it comes to health?
Yeah, it's a really interesting question, Paul. Yes, the gender gap is there, and it works both ways. So the fascinating part of this is men on average, and this is a global trend, appear to die 5 years younger than women. And that is the case in high income settings like the UK and US, but also across the globe. And it's only got worse. In the turn of the century, according to the data we have, the gap in life expectancy was only about 2 years. Now it's 5 years. And, so you think 100 years worth of progress, and things have got worse rather than better. And the million-dollar question is, why is this happening? Why do men die younger than women? There are clearly biological differences between men and women that might explain it. So, for example, men have a Y chromosome and an X, women have two X's. So there's some genetic conditions where if there's a problem with a gene on one chromosome, women have a spare chromosome. So that means that that can kind of cancel out that faulty gene. Men don't have that, but that really doesn't. And the other physical differences between men and women aren't really a full explanation. So I think the reasons are poorly understood, but the specific conditions that might account for this include higher rates of cardiovascular disease, particularly so things like heart attacks, strokes.
I think it accounts for about 12% of all deaths of men, right?
Right, it's huge. Yeah. So that's much worse in men. Rates of obesity and being overweight. Men engage in more risky behavior as well. So particularly younger men, they get involved in a lot more accidents, more trauma. Mental health, particularly suicide, is very high in men. So there's certain conditions that are well described as being worse in men, but also there's the kind of social piece as well. Men's health-seeking behavior appears to be different. So they tend not to present to health facilities very often, and when they do, they present late. And they just have a lot less contact with health services, like me as a GP. So there's less opportunities to address some of those unmet health needs. And also I think there's a mindset amongst men. There's perhaps a cultural piece there as well. I think men are much more inclined to just kind of bottle things and deal with them in their own way. They're not necessarily going to share their problems and seek help in the same way that women do. So there's definitely differences there. And one thing I want to emphasize is that gender gap does work both ways. So there's certain conditions that are worse with women. For example, women suffer much higher rates of anxiety and depression. They're obviously with childbearing, there's all the health need that comes with that. And also all the drugs that are designed in modern medicine are tested on men, and the whole system often is designed to treat men. So I think women are underserved as well in different ways.
Sure.
And the final point I want to make is, on the whole, I think the gender differences are overplayed, and actually most conditions affect both genders. So while there are differences there, most of what we talk about today applies to women as equally as it does to men. Yeah,
interesting. And I think, am I right in thinking that men probably misuse things like drugs and alcohol as well? Does that play a part?
Yeah, it does, massively.
And do you know if that's, I guess, sort of historically, you could say sort of men maybe has sort of a much better position of privilege in regard to many aspects, pay and everything else. And I think that's starting to shift a little bit now. And as we see more equality, do you think that's going to have potentially a knock-on effect to men's health through maybe more misuse of those substances? Is that something you're seeing at all?
Yeah, it's really hard to say. I think, historically,
I know we're speculating a little bit. Just interested. I think, historically, men have always been always had the upper hand in history, haven't they? They've always had the positions of power. All the historical monarchs and political leaders have been men. Men, like you said, have generally paid more than women, and so there's all of that, and with that comes sometimes higher socioeconomic status, and we know that is so. When being better off, being wealthier and more powerful in society generally benefits your health. The people that lose out in society are the ones that are the lower end of that spectrum. In terms of whether gender equality is going to improve, it can have an impact on men and women's health imbalances. Is really, I wouldn't want to speculate. But no, fine.
That is definitely part of the puzzle.
Yeah. And the other thing I just wanted to ask as well on that, just in regard to, I guess, age. Obviously, a lot of things like heart disease, they kind of accumulate over time, but typically you see much older people dying of those sort of diseases. But I'm also wondering with sort of the younger generations now, where you've got things like social media and people are a lot more body conscious and to some extent health conscious, to some extent less health conscious, I guess, with some of the things that they maybe use to achieve those physiques. But Do you think, or do you see that maybe it's sort of more of an issue with men sort of 30 plus, or is it just, again, hard to say all across the board?
Social media is, I feel it can be a huge asset with regards to improving men's health, but it can also equally be a huge threat. It can work both ways, and it depends what kind of content people access. I mean, social media used in the wrong way, there's loads of examples of people with eating disorders, men and women, who are heavily influenced by certain personalities that are openly broadcasting ways of extreme dieting and purging and really unhelpful behaviors. So the anorexia community, there's the whole there's a whole movement there, and there's also around self-harm. There's lots of very unhelpful content in that domain as well. Admittedly, this is more, a lot of it's targeted at more easily influenced groups such as teenagers, adolescents.
Yeah. But I think you meant to say, so with regards to that, one of my clients brought their nephew to me on Thursday, and he watched a video. He's autistic, and he watched a video about having no carbs in his diet. He's lost 3 stone in about 2 months. He's nigh on anorexic now. Yeah. Because of one video. Because he watched this one video, it really resonated with him. Yeah. And he thought, oh, I'm fat or I'm overweight because, just quite literally because of this, because I'm eating carbs. Then from that day, he's not really at a carb for however long. So I had a good chat with him and then talked to him about balanced diet and about getting things right. Just by him talking to me, he went home and then, ate some fruit straight away, because I said to him, you need to eat 2 pieces of fruit a day, just to get him back in. And now he's going to be a client of mine just for a couple of months, just to get him back on track with his eating, because he was so, hypnotized by this one video at a certain age where it just completely which I was a bit dumbfounded by, because I didn't think it would have that much of an impact. But again, it depends on the person, I imagine, and that's following on what you said.
And the content. We've talked about the negative potential harms of social media, but like you say, there's a flip side. There's a positive, and it's a huge opportunity to influence people's health behavior.
And I don't think people realise
with the right content. Yeah,
I don't think people I watched the video, and it's just a fitness bloke saying about how good the ketogenic diet is, and just going into a bit of depth of the ketogenic diet and why it's good. And I don't think the guy meant to do what he's done, but he wouldn't have realised what he's done. You know what I mean? But then it's gone to such an extreme. Someone's took it so literally, so extreme. He's not talked about calories. He's not talked about quality of calories. Not talked about any of that sort of stuff. Just like cut carbs. Carbs are bad. Carbs are this. Carbs are that. So then they're not. He wasn't even following certain calories or macros with his diet. He just cut out carbs. So he's hardly eating because he didn't even know the foods to eat that weren't carbohydrate.
Yeah, it's definitely a bit of a. Definitely a bit of a rabbit hole, that, isn't it? But yeah, no, interesting. Well, no, but I just thought I was curious about asking, because I know the sort of, typically speaking, the older generations don't have, they have access, of course, but they're not, as ingrained. It's not as ingrained in them, I think, the social media.
But people are still accessing the internet for health information generally. And if it's not necessarily social media, it's YouTube, it's websites, web pages, and I think most people get their health advice from the internet nowadays. In days gone by, that generation would be in the nuclear family, and you'd be speaking to your grandparents. There'd be loads of home remedies being passed down. Nowadays, that's all. People are moving out as soon as they're 16 to 18, and people just don't have that same intergenerational transfer of health information. It's really now everything just goes online, and yes, there's some great information on there. It's an amazing resource, but equally it can be misguided. A minefield.
It can be misguided. That's the truth of it.
Yeah, it's very unregulated, isn't it? That's the problem, I think. Yeah, interesting. So I guess with men talking about this slight difference in sort of health markers, do you think there's barriers that stop men sort of living sort of happier, healthier lives? Or what are the key barriers? I'm sure there's plenty.
Oh, yeah, no shortage, I'm afraid. One thing I'd like to just bring in is this. I think one of the great things that's happened in the last 5 to 10 years is the explosion in the well-being space and this awareness of this concept of well-being. It's kind of why you guys exist, why we're here. And that's a brilliant thing. And that is, to some extent, seeking to overcome the barriers. But for me, the rest of the world, the kind of structures and fabric of society is yet to catch up with the aspirations that well-being has. So I think, yes, everyone wants to aspires to happier, healthier lives, but the places that we work, the way we move around and the environments around us aren't yet set up to service that. So for me, the barriers are largely structural. Ultimately, we want men to make better choices, healthier choices that positively impact their health. But the biggest structural barriers that are there are, things like access to good quality health information, which we've just talked about. Yeah. A lot of dodgy stuff out there. Also, in terms of diet, good opportunities to eat, diets that are low in processed food, low in salt, low in sugar, reduce their alcohol intake. And I think there's a lot of societies very much, just take North Plymouth, for example. If we came out of here and wanted to get something to eat, what are options? Very limited. We've got McDonald's, we've got a Pizza Hut. Yeah, if you've got the cash, there's an M&S food, but it's a bit of a food desert, and that's fairly typical for a lot of cities. Fast food restaurants everywhere. So there's structural problems there, and all of those fast food restaurants, incidentally, are built right opposite schools because they know that loads of kids will just go in and use them. There's the way we move, and we'll talk about this later, but one of the biggest barriers is sedentarism. And I think just people just being sat all day in the office, commuting long distances to work, just not having the time or the wherewithal or the facilities, the sports and leisure facilities in their vicinity to get the exercise that keeps them fit and well. And then the other big barrier is around the way we work and the amount of stress and complexity of modern life. I think many people just find that kind of overwhelming, and that also impacts the other things because they're so stressed and overworked, and they've got all these different responsibilities as parents, as all the other roles in their life. They're not looking after their diet. They're not getting the exercise they need.
And they don't think it's important. That's the big thing that I find with a lot of people. They become extremely successful in whatever they do, whether it's business or in their jobs, promotions, this and that. And they really neglect their health for years and years and years and years and years until they get to their maybe mid-50s. And they go, oh shit, I really need to sort this out now.
The
because
battle back's then tough, isn't it?
Exactly, yeah. I've got high blood pressure, I've got this, you got that. Yeah. And then they think, oh, I've got to do something now. And sometimes it's a little too late. Does that make sense to her? It's a little bit.
Such a good point, Danny, because as a GP, it's such a common consultation for me. I have a guy between the ages of say 35 and 45, and he's coming to see the GP for the first time in his life because he's just had this epiphany, and he's kind of like, wait, I'm getting old. I'm aging. Hang on. This is crazy. And they are common things that ask for a blood pressure test. Kind of well-man check my blood pressure, check my cholesterol, screen me for diabetes. Can you feel my prostate? Make sure that's okay.
People know to come in and just do that. Sorry, just a quick. If a guy wanted to go in and just kind of check his bloods or his vitals, as such, are they allowed to come in and just do that, or is it like I didn't know.
You need an appointment, so don't.
Just climbing through the window.
Just come in. Yeah, stick a needle in me. Yeah.
So without any kind of symptoms, could a man just proactively come and do that
and go?
Yes.
I didn't know that.
And is that up to the? I think we're asking because we had the impression that there would be some barriers to doing that because of resourcing, and it feels like unless you've got a reason to have those things checked, actually get an agreement from a GP surgery to do that and spend the time and resource to do that is quite a challenge. And I think you're maybe quite forward thinking and fairly active in regard to that stuff, but maybe some other GPs not so much. So is that general practice that you can just make an appointment and have those things checked?
Yeah, I think it's good to do that. I think it's good to know your numbers.
Yeah.
I think there's a lot of emphasis on lifestyle, and everyone kind of is aware that they should be addressing smoking and drinking less and keeping a healthy weight, but knowing what your blood pressure is and ideally your cholesterol levels, those are kind of basic parameters, because there are lots of changes you can make in your life and potentially also certain medications we can use to maximize your life expectancy and maybe get it more in parity with women and also reduce your future risk of things like heart attacks and strokes.
100%.
And if you don't get those things checked, I think around the turn of coming 40 is a good time to do that. You just won't know.
It's really interesting.
And it's about lifetime risk. So the longer you're living with, say, unmanaged high blood pressure, unmanaged high cholesterol,
100%.
all that risk accrues, and it won't catch up with you until you're, say, 60 potentially. But if you deal with it,
and that's when they kind of like, people just drop dead, really, isn't it? Heart attack and they're gone. And
men, Get your blood pressure checked.
Yeah, 100%. Yeah.
You mentioned about the work thing and the way we work is a potential barrier. And I think Danny mentioned as well about people just aren't interested or don't see the benefit in exercising. And I think that's part of the issue, because I know my parents don't exercise. I don't know about yours. And when I say exercise, I don't mean just moving. I mean purposely exercising.
I get a lot of time saying I'm a dog walker, or I'm a, that is very mild exercise, and they're not discouraging it, but it's not getting your heart rate up.
But I think moderate exercise, that is considered a sort of brisk walk, and we want to be doing 150 minutes of that a week. Inactivity, I think, is defined by less than 30 minutes of that type of activity. So it's literally nothing. And I wonder if there was a time, certainly with men, where, before the technology boom, a lot of industry was around physical manual labor. So you didn't need to then go to the gym because it's taken care of. And I think the way we work now, it's, there's a lot of, sort of technology doing a lot of those sort of jobs for us now. And a lot of men and women, but people sort of in office-based jobs, sat down all day. I feel like that's probably a huge barrier. Yeah. Would you agree?
Yeah, definitely. Yeah. And I think, I'm talking to two PTs here. So obviously, I feel it too. I'm kind of big into kind of competitive fitness. So CrossFit.
I like CrossFit.
Oh, no way. So I'm doing the Open at the moment.
Oh yeah, you're doing the Open?
Yeah. I just did 23.1 last night.
Did you?
Anyone that's into CrossFit.
Yeah, that's cool. Yeah.
Ruined me.
So for those that don't know about CrossFit, that's
so they do. Yeah. So CrossFit do a open workout every year where everyone in the world is free to do this workout, or the 5 workouts, isn't it?
That's 3 at the moment. Yeah,
3. Yeah, and basically you record your workout, and then it goes into a leaderboard, and then if you make the top 20 in the world or something, you get to go to the CrossFit Games.
Right.
So it's a really cool access into.
Anyone can go. Yeah.
And then you have like age groups as well. So what would you be master?
35 to 39. So
Masters.
Asking that, man. Come on, he's helping us out.
But what I mean is, he could be a world champ at Masters too.
Okay.
I have to get better at CrossFit first. But in theory, it's possible.
It's good, isn't it? Yeah.
But I mean, that's an example. That is HIIT training, so it's kind of extreme exercise, and I like
it's
that.
Very extreme.
I'm like you guys. I'm time poor, so I need to go to the gym. I need to get sweat on. I've got an hour. I've got that time window, and I need to get my money's worth out of it. I'm not doing step aerobics, but equally, I recognise that lower intensity exercise is absolutely appropriate for a lot of people, and some exercise is better than none. So that works in my life situation. But there's a really interesting piece of research that came out in 2015 that showed that yes, exercise is important. Going to the gym a couple of times a week is good. But if you do that and still sit at a desk all day and have long commutes in a car, so still technically sedentary in every other aspect of your life, your risk of type 2 diabetes, obesity, heart disease, etc., all-cause mortality is still very, very high. So as well as exercise, in addition to going to the gym and ideally getting out of breath, getting your sweat on, you need to be active in your day-to-day life. And that's something we'll come on to maybe a bit later, but it's not enough to just go to the gym and feel like job's done. I'm going to sit on the couch for 3 days.
I've heard the term, I think, exercising couch potato somewhere.
Yeah.
Which is, I think
exercising couch potato. That's really good.
Some of these guys turn into weekend warriors, and they'll literally just maybe play 11-side football on a Saturday, and that's the only exercise they get. Especially when you're in your 30 to 50 year age bracket, that is just a prime territory for injuries as well. That's when you really mess yourself up, because your body's just not conditioned.
We're not 20 anymore. That's why.
Exactly. Yeah. You can't get away with that anymore.
Yeah. But you're right. I see it a lot. So I've done a bit of work in obviously sort of injury rehab clinics and stuff, and you see it in the new year where you get people sort of hobbling in.
Yeah.
Like end of January, and you're like, what's happened? And they're like, I started running.
Went back to football. Yeah, I thought I'd give it one last go.
When was the last time you did that? 10 years ago? Did you ease yourself in? Nah.
Straight back in.
Yeah, so you see it a lot. No, it's funny.
Yeah.
Cool. So we talked a little bit, I guess, about style of working, sort of the food available and everything else. So I guess this is quite a broad question, but what role do you think the government plays in men's health?
Yeah, it's a really good question, Paul. And I think this is around health policy, sensible health policy that prioritizes health, and it puts the structures in place for people to make the right choices. So we've seen some great examples of good public health policy that have been introduced, like banning smoking in indoor places. Brilliant. I mean, that has saved so many lives. Why we didn't do that sooner? Lobbying from tobacco industry, obviously, but various other things. So that's one example. Minimum price per unit on alcohol. I mean, that disproportionately benefits the lower socioeconomic groups that are most vulnerable, So it actually leads to lower alcohol consumption overall. Just simple policy like that, just reducing access to cheap booze where people can really get themselves messed up.
100%.
It's such a kind of simple thing, but on a population level has a massive impact on health. The other one is sugar tax. Great thing. Just making it harder for people to put products with high sugar content on the shelves that people then just buy. And labeling, a correct food labeling. So you can have the kind of traffic light system. Have you seen that's been introduced?
Yeah.
Just makes it easier to decode what's in stuff and what's healthy and what isn't. It's just stuff like that is brilliant. There's also a bit of legislation that's been held up, which I think will have a big impact. A big one at the moment is advertising junk food to children. That's still going on.
After 9 o'clock, isn't it? Going to?
That didn't happen though. It was meant to.
Yeah,
didn't
exactly.
happen.
It's all been kind of.
Oh, really?
There's a lot of lobbyists. There's a lot of industry interest in all of these areas.
It all comes down to money.
Exactly.
Money over health.
Yeah.
Money over health.
So there's
And that's
loads of
what
stuff in
drives
the pipeline
crazy.
that's just being kicked down. The can's being kicked down the road. So there's more work to be done. But I think the government and policy is a massive part of the puzzle in men's health. But that's not necessarily something we're going to influence as your average everyday man.
Yeah.
Unless you're politically active, you can vote for governments that have progressive policies like that. But I for this conversation, I'll try and focus on what we can actually do. It's within our locus of control.
Yeah, no, 100%. Yeah, no, it's an interesting one, isn't it? I think certainly with the kids stuff, I think I'm not sure the exact numbers, but I know there's a bit of a sort of an overweight and obesity problem with young children as well.
Oh, yeah.
It's huge. It's
Yeah.
absolutely huge. Like I pick up my boy. Obviously, he's a little bit older, and so many children are overweight.
Yeah.
Like I'm not, like not just a little bit.
Yeah.
Not just a little bit. And I know they had COVID, and a lot of them were just sat around, and they all come from different backgrounds, and you don't know what their home life was like and stuff like that. Whether their parents were, just get up in your room, play PlayStation for 6, 8 months, 9 months. But I think in general, I think schools can do a lot more.
Yeah,
You go back to
100%.
the Jamie Oliver, he used to go in schools and he got rinsed for that, which I find crazy because now I look at it, my boy, he'll do vegan Mondays or vegetarian Mondays, sorry, which I've got no problem with, but he'll come home and I'll go, what do you have? He go, pizza. And I'm like, you know what I mean? Like you're trying to spin it in a healthy, positive way, and then they give him rubbish food.
Yeah.
And then he'll come home. We were saying the other day, he's quite a bright boy, and he'll do well on his maths test, and they reward that with a donut. So then in the end, I have to go and tell him no more donuts because they would do it all the time. And it's a really good school he goes to. It's not. It's one of the top Ofsted reported schools in the southwest of the country.
Yeah.
So if they're getting that, then what's the other schools getting? Do you get what I mean? If that's the top school, primary school in the country, in the southwest, then what the lower end schools doing? What are the school meals are terrible, terrible. He comes home, he's like, "That's like dog food."
Yeah.
I'm like, "Really?" He's like, "Yeah, terrible."
Yeah, as when I was a kid, it probably hasn't changed much. It was the options were largely chips, battered sausage, chips with battered sausage. Was what most of my contemporary. I was a loser. I ate the set meal every day, which was kind of actually had some veg in it.
Yeah. Right.
But most of my mates would just eat the chips and battered sausage, or maybe some battered cod or something. Because you could. There's nothing stopping you. Just lather it in salt and vinegar and ketchup. Yeah. It's just it's a train crash of a meal, really, nutritionally. And that is.
I used to have turkey Twizzlers. Can you remember them?
Vaguely.
Turkey Twizzlers. They were terrible. They were processed and barbecue sauce. They even stopped them. They were sawdust, but that's what we had twice a week.
Yeah, we had something called a space burger, which was
space burgers.
You used to have them as well.
I used to have a space burger.
It was just like a patty of meat with I think sauce or cheese, and it was in pastry.
Yeah,
it was like a pastry burger.
You used to have pickle in it. You used to have pickle in it.
Oh, mine didn't. I wouldn't.
No,
I wish they did have that. I would have eaten a lot less.
It's very
burger,
high
cheese,
in
pickle.
salt and fat. Nutritionally just kind of derelict, isn't it?
Yeah,
and the crazy thing is, it's such a missed opportunity because that's a formative period in your life as a child where we know that fat kids become fat adults.
Yeah, 100%.
It's a sad truth.
Yeah.
And your habits and your behavior and your relationship with food is forged in those formative years. And if you're going to mess kids up by giving them that kind of food in school and that becoming their normal
day to day,
then what hope have they got in living fulfilling healthy lives as
But I
adults?
don't know what, even as a parent, what can I do about that? Nothing really.
Damage limitation, mate.
Yeah, exactly.
Damage limitation. I think, and education.
Yeah, it's hard, isn't it? Yeah.
It's a mad one. Anyway, we digress a little bit. Men's health. We touched on sort of inactivity and, sort of the population being inactive, but men in particular as well. What do you think could be done about that?
Why don't we do it in reverse? I could talk about the things that I think society should do.
Yeah.
First, we do that. And then I could talk about perhaps more in terms of actionable things we could do in day to day. Does that make sense?
Great. Let's do it.
So from a society level, there's one, I think the biggest thing with activity is, we can get people going to the gyms, but a lot of the evidence shows it really helps to build activity into your day-to-day life. We're talking about active lifestyles. And unfortunately, the way we talked about barriers earlier, the way that we go about our lives, we live in a car culture. You can't deny that. Everything to get anywhere, you just kind of have to have a car. I mean, there's train strikes going on anyway, and everything's so far away. And many of us are commuting more than an hour to get to work because that's the only place that we can do that work. And just everything's just set up all wrong. So we're just spending all our time in cars going from one thing to the next. And then we get to our work and we sat down and slouched over a desk all day and we're just not moving at all. We'll maybe get up to take a piss and then we'll go back and be typing away at the keyboard. And then we get back home, we sit on the sofa and we watch Netflix all day, And so it's the way our life is set up. It doesn't serve us, and our bodies are evolutionarily programmed to move, and that movement is, for me, is what's lacking in the way we live in society. And I have this vision, and there's this great vision of town planning called 15-minute cities, where everything is within like a 15-minute radius. So cities that are designed almost like big cities would be divided into little districts where you have everything you need, all the amenities, all the kind of workspace, leisure spaces, all within that close distance.
A 15-minute walk.
Within a 15-minute walk, yeah. So you can walk or cycle everywhere. And what I'd love to see is a world where everyone is doing that, where everything is accessible and you can walk and cycle, and you can be traveling, active travel to get places. So I think the structure of society doesn't enable people to be active in their day-to-day lives, and that needs to change. And I think it will, and we're seeing a lot more bike lanes being put in. We're seeing a redesign of urban spaces that facilitates people to move around by walking and cycling and public transport as well, rather than it being completely car oriented. So that's the kind of structural piece that's the biggest barrier in the way that people live. And then kind of on an individual level, I think for me, it comes down to how you choose to live your life. I mean, I've deliberately set my life up. I've made a series of choices that enable me to build activity into my day-to-day life. And this is outside of kind of sports, going to the gym and stuff. So I purposefully choose a workplace that's within cycling distance. Because I'm a GP, I only work for practices that are within cycling radius of where I live. And I live specifically in a city because that enables me to do that. If I live in a rural location, I have to drive. So I just don't do that. I love being in the countryside, but it involves a lot of driving. So I've just opted out. I'm in a city. Other things like, instead of sitting at a desk like we are now, and I know, Paul, you've just gone down this route, getting a sit to stand desk, and I've had one for a couple of years now, and it's just the best thing ever. And instead of just being sat all day in a stationary position, you can get up, you can move around, change positions, you can get a desk bike or a desk treadmill. I mean, this is all getting a bit wacky now. But there's ways in your day-to-day life you can look for opportunities to build activity and movement into your day. And that might even just be getting off the bus one stop early and walking the last section. It might be just walking your kids to school if instead of driving them around the corner. So it's all about looking for those extra opportunities and just making your day-to-day more active. And I appreciate for many people with their life situation, that is very difficult, but I think it's something you can cultivate and you can build into your life through a series of deliberate choices.
I think, you're exactly right in what you're saying. It's just actioning that for a lot of people, isn't it? Because a lot of people are not earning massive amounts of money. People are maybe in areas where it's not that great to walk around. There's situations where people have to be at work for a certain time. They have their children to get to get at school at a certain time. They then do what you say. They sit at a desk all day. It costs more money for a stand-up desk, maybe.
Yeah.
People then become less productive, maybe because they move around a bit more. Things like that we, I think, as a society, have to overcome to move forward with that, because there are so many different. I'm just thinking from like a regular person on minimum wage with 3 children.
Yeah.
You know, it's so hard. You know, it's probably manic when they wake up in the morning, getting the kids ready, doing that, getting, you know, they're rushing, getting them to school. They're getting, you know, and I think that's what we need to work towards is up in maybe like things that will solve it will be higher pay across the board.
Yeah.
So that everyone has that little bit more financial freedom, that they can work a little bit less. Even if it's, you know, we cut down maybe from a 40-hour week to a 30-hour week.
Yeah.
Little things like that where we have that little bit more time to get our kids to school and then walk to work. But until those sorts of things change and we can change that in society, I don't think we're really going to have that anytime soon.
No, but I think to that point, mate, I think that's a reality of it. You know,
Yeah.
Let us know when you're building your country because I'll move in for sure. It sounds great, but the reality is I don't think it's going to happen.
Yeah.
Certainly not anytime soon. So I think to Will's point, it is about what people can do with their own choices.
Yeah.
And I completely agree that you've got people that don't have the means to you know, sort of work less to be able to exercise or move more. But even the stand-up desk, there are really cheap solutions.
Oh,
you
yeah,
know, I think
definitely.
Will and I have the mechanical ones that go up and down, which are great, but you can just buy a very cheap stand-up desk. You can use...
But then that's the workplace that has to implement that for the
Exactly.
workers.
Yeah,
that's
yeah.
my thing. Like
Yeah.
A lot of
for example,
workplaces aren't,
do
even the
your
G-
workplaces do
the
that?
GP surgeries I work at, none of them have standing. I've mentioned
what I was
standing
about to
desks numerous times, and the health benefits are well described in the literature. But you know, exactly, I say these are the structural barriers. We're not there
If
yet.
you're not doing it,
Yeah.
it's really hard to say, you know,
yeah.
if a GP surgery and the people that we go to for, you know, health advice and expert advice are not doing it themselves, how can then we turn around and go, oh yeah, you've got to do this?
Yeah.
And that's where I think it comes into.
Yeah, but I think there's still a lot that can be done. So, you know, like Will said, where you can and it's safe to walk to work. You know, if you are sat down at work, take regular breaks. Employers will allow you to do that. Get up and move around a little. Take the stairs, don't take the lift.
Oh, yeah,
Walk at
that's
the back
a huge one.
Walk at the back, park at the back of the car park and walk in. So I think there are little things that people can do throughout the day just to increase their physical activity and it will add up.
Yeah.
So I think there's lots to be done, but lots still to get done as well.
It's just such a huge topic, isn't it?
Yeah,
exactly.
And
The thing is,
everyone's situation is different.
when your eyes are open, like I feel mine have been, you see all these barriers in society, and you see how difficult it is for everyone to build that in. But like you say, Paul, it's all about actively seeking those opportunities where you can. I mean, one example is before I went to med school, I worked for Original Style Tiles in Exeter as a customer salesperson. I was in the office, and the office. This is pretty typical, you know, white collar, blue collar divide. All the white collar people in the office and the sales team, like me, during their lunch break, they'd be sat at the desk. They'd generally kind of put their keyboard away, get their book out and their sandwich, sit at the desk, eat their lunch. Oh, it's lunch is over, and then they'd kind of crack on. Never leave their desk. They might go up and use their photocopier maybe twice in the day, but that was it. The factory guys, they were way more fun. I used to go down and hang out with them at lunchtime. They used to have a football game in the yard where all the lorries were. And so I'd go down there with I was the only person there not in overalls and the shirt and tie. And we had the most epic kick around. You know, we were like, it was proper kind of like schoolyard football. It was brilliant.
Taking your shins out.
I'd come back in after my half-hour lunch break, and I was sweating like a pig. I was like soaked, shirt was just soaked, drenched.
And no kneabcaps after the factory workers took you out repeatedly. Is that
But
what
I
it
was
is?
like, that afternoon, everyone else was falling asleep, and I was like fired, you know, because you have that, the endorphins that you release from exercise, and how that energizes you. Admittedly, I stank pretty bad, and I really should have had like a change of clothes or something. I was 18, I didn't really know, but that's an example of that you've taken opportunity to get exercise in the day. And I think there's loads of little moments. There's moments in the day where you can do that. If you're looking for it, you'll find them.
Yeah, no, you're right. I think the active lunch break's a really interesting one. I spent about a decade working in office jobs, and for probably about 7 of those 10 years, I was pretty sort of dedicated to getting to the gym at lunchtime, and I was fortunate there was one nearby. But even just going out and going for a walk, the productivity increase in the afternoon as a result of doing that was massively noticeable.
Yeah.
Yeah, I can
it's really
imagine,
good. Yeah, we talked about barriers, and we're all dads. We talked about a second ago about, you know, sort of the busy guy getting up with the kids, and sat here right now talking to you, I feel half asleep because I have a 3-year-old. So I think definitely becoming a father as a bloke has a real impact on your ability to exercise. But from a health perspective, do you see a noticeable difference between men who are fathers and those that aren't?
Definitely. And what I see anecdotally as a GP is in keeping with what the literature tells us, that health outcomes in men, you're looking at blood pressure, cholesterol levels, BMI, they all decline in new fathers.
Do they?
It's a difficult time. A lot of at that point in your life, a lot of emphasis is on maternal and child health, rightly so. Women have had the epic body shock of having to give birth to a child. Sometimes it involves a massive surgery, like a cesarean section. They're then breastfeeding, all that stuff. And, there's definitely massive health needs in women. But hidden behind that, I think men's health also deteriorates, or perhaps more silently, because I think that, naturally as parents, the emphasis shifts from your own needs and your own well-being to that of this screaming infant that's just entered your life like a freight train. You're just kind of reeling, thinking, what on earth has just happened? It's a kind of natural product of that massive. I think it's probably the biggest shift in your life you can have as a bloke is having a kid. Do you think?
Huge. Yeah.
So it is a big problem, and I think there's lots of reasons why men's health does decline, but I think the biggest one is that shift in focus, and I think how you tackle that is an interesting question.
I think we are, quite rightly so, I will say, but we are put on the back burner in that situation. You know what I mean? So once the baby's here, obviously everything's about the mum getting her well again, how she's getting on with breastfeeding, blah 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 blah. And we are there to support, but at the same time, that support can be pretty hard. But we again, men don't talk about it. We just bottle it up, suck it up, and we just carry on, don't we?
Yeah.
And that's where I think it leads to drinking, depression, no outlet, shit job. They could be a labourer, not doing much. You know what I'm saying? It all stems from that. And again, it's us being at times repressed. But I understand why. But again, it doesn't make it any easier for the bloke.
No, it's a fascinating one. To your point, Will, I think when my son arrived, and I don't know if it was because the woman has it grow inside them, so that they kind of have that almost instant connection. Whereas I found for me, it, to some extent, just appeared. I work in gym, so I'm used to seeing people with bellies.
It just appeared. I love it. Just appeared.
It's just here.
And suddenly I was, like you say, just thrust into this kind of, this
and
position of dad.
Yeah, you're expected to kind of, and because most people are good people, they want to help. But I remember my wife saying to me, are you not interested when she was pregnant? I was like, I am, of course I am.
Yeah.
But it's really hard because nothing's changing for me.
Yeah.
At this point, nothing, she's pregnant, she's heavily pregnant, and I'm there for her, and we're doing all the appointments and but really nothing really is changing to me, at all. And then one day, baby.
In a puff of smoke. Just drops this thing off and up.
After the most traumatic day of my life.
Yeah, tell me about it. Yeah. But
Do you know what I mean?
but it's mad. But I think you mentioned about the drinking thing. I think for me, because suddenly I had this new level of responsibility, it certainly removes my ability to do some of the things that I previously would have done as a man without a child or a single man. And as a result of that, I just found myself drinking a little bit more because I couldn't go out and maybe get that, that release or, those kind of, that sort of rewards from something else by being more active because I was exhausted all the time, didn't have any time. I found myself certainly drinking a little bit more. And then that just is a knock-on effect because that impacts your health and your energy levels and it just becomes a bit of a downward spiral.
Massively, yeah.
It's definitely a real challenge.
Yeah. I don't think there's a bigger challenge in your life.
Yeah, I agree.
I think it's from the time they're born right up into, obviously my boy's only 10 or 11.
Yeah.
But it's a changing challenge. See what I mean? Like you just, you nurture them young and then as he's getting older, he's turning into like a young man now.
Yeah.
And all the things that come along with a cheeky young man who's, got all this stuff and you carry on
They
with
say
that.
the problems don't go away, they just get bigger and more complex.
They do. They
just
really
change,
do.
yeah.
Like, and he is a good boy. That's a good thing. I think I'm steering him in the right way.
Yeah.
But again, you never know. That's the thing I don't like a little bit. You never know.
Yeah.
He's going to hit puberty soon and, that's going to change him a lot.
Yeah. And I think we should probably all state now, just in case anybody's listening, but children, we love you.
It's great. You're awesome. Yeah.
But you're just hard work at times.
It's a challenge. Yeah.
Yeah. Cool. So we talked tons about sort of health and stuff. One area that I really want to touch on is obviously mental health in particular. I think we've kind of, sort of alluded to it on a couple of occasions, but a lot of what we've said, ultimately leads into how we think and that kind of ultimately means or leads to what we do. But in general practice as a GP, what do you typically see? from that perspective?
Yeah, in terms of men's mental health, it's the biggest things really anxiety, depression, and I'd say work stress and overwhelm are the main ones, and suicide risk actually, particularly middle-aged men are the highest risk group for completed suicide. It's a big part of the work.
And why do you think that is? Like, honestly, like, why do you think it's a middle-aged man? Why is it not an older man? And why is it not a younger man? Does that make
It
sense?
seems to be across the board a little bit though, because I think, it's probably because there's less things to kill you, but certainly between, I think between literally from 5 to 19, it's the biggest killer, suicide in males. And I think between 20 and 34, it's the biggest killer. And that's probably because there's not a lot else to kill you at those ages. But that does show that men are obviously taking their own lives. And I think men are probably more likely to do that, than women. But I think it's 3 times more likely. I think men are
something like that.
Yeah.
The interesting facet is that women are more likely to self-harm. So I think they do behaviors that are less perhaps dangerous. Whereas men, in terms of completed suicide, they tend to use more lethal methods. So if they overdose, they'll do it they'll go all out in a way that women perhaps won't. So there's definitely a difference there in terms of.
Yeah, I think it is that, and I think it's just the general pressure that we put ourselves under, and that's one thing that I struggle with sometimes. Is I always want to do better, no matter what it is. I get to a point and I'm happy, and I'm like, and then I look on to the next thing, and I think, as a man who wants to do better in his life and wants to progress and wants to do lots of different things, we kind of tend to put that pressure on ourselves. And I think at times, if you do fail at those things. And then I think of myself, if I was, in my mid-40s and I was nowhere further or even less of where I am now, how I would probably feel. Because so far I've kind of kept pushing forward and keep trying to, progress and do things again. But there's going to be times in my life maybe that things go backwards. And I think when you come to those points, I think that's when you think, oh God, I'm overweight, 45, I've lost half my house, I might be divorced, might be this, I might be that. And then you think, oh God, you've come so far and then gone all the way back. And I think that's when a lot of it comes into, mental health, struggling, suicide.
Massively. And I think from evolutionary terms, men traditionally is hunter-gatherers. I think we are very achievement oriented. And I think we're very hard on ourselves as a result. If we feel like we're in a stage in our lives, in our kind of midlife, where we just haven't quite got to where we want to, and lots of areas of our life are failing, and kind of between the ages of say 35 and 45, that is where lots of marriages break down. That's where lots of careers come unstuck. Financial troubles come in. You've got sick parents. You've got the challenges of parenthood yourself as well. So there's lots of things that close in on you, and that sense of failure and is difficult, and that's combined with, and I'll just to kind of allude to what I mentioned earlier, the differences in health-seeking behavior between men and women, the fact that men don't seek help that as readily, and when they do, they go too late, and when they do seek help, I think men are also less able to open up. They're not able to necessarily share their feelings. I think we're much more inclined to bottle things up. We just kind of get on and cope. There's a real stoicism. And I think certainly my dad and my grandfather's generation were all about you just pull your socks up and get on with it. And that's such a common attitude. Even now, it's still pervasive, I think, today to see that. And that really has to change, because that unfortunately is not a constructive way to deal with the kind of mental health problems that the modern world throws at us.
So if those problems do occur to someone, is the best way just to contact your GP?
It's a good starting point, because as a GP, I'm able to, I can't necessarily solve your problems, but I can signpost you in the right direction. And a lot of dealing with mental health is plugging you into the right resources, the right kind of treatments. A lot of that's talking therapies, things like CBT, cognitive behavioral therapy, is one that's been used for years, but there's newer ones, ACT and counseling, psychodynamic psychotherapy. I mean, the list goes on. So that's really good. Activating your own support networks. So making sure that you're making the most of supportive relationships and family and friends that you have around you. Having that around you is massively beneficial. Tackling drug and alcohol misuse is a big part of it. And the other thing is sometimes there's a role for medication. So we do use a lot of antidepressants, and they're not, again, a panacea. They're not a magic bullet, but they can give people a bit of a lift and just be part of a wider range of treatments that can get people out of trouble.
So I know there's like a big, I don't know if it's a misconception or not, but it from my point of view, I've spoken to people that have gone on antidepressants, and they seem to see it as a bit of a weakness of themselves when they've gone on antidepressants. Yeah. Do you find that as a problem to get people on antidepressants, or would it, is it better to go and exercise and try and sort their life out, or to go on antidepressants first? Does that make sense?
Yeah, it really depends on individual circumstances, right. And you do get I do sometimes hear that from patients, male patients particularly, this sense of failure.
Yeah, that's what I hear.
Inadequacy,
I don't need it. I don't need it.
Yeah, I think antidepressants do get a bit of a bad press sometimes, and there's a misconception that they're perhaps addictive drugs, which they're not, and that somehow they're failing as a man because they're not fulfilling in their duties. They're not strong and they're not masterful, and they don't. It's kind of this admission that you're somehow weak and not worthy, and that none of that is true. And addressing some of those, I think, dysfunctional health beliefs is a key part of treating the illness, the underlying depression, and that's really where something like CBT comes in. That's where it can be really powerful. It identifies
cognitive behavioral therapy.
Behavioral therapy. It looks at what we call negative automatic thoughts, some of these ideas that we have that are perhaps untrue, but we don't realize that. So it shows you that you're kind of self-sabotaging with the way that you approach the world. Yeah. Some of the ideas you have are not serving you, and it helps to unpack those and reprogram your brain. So it's very much in the here and now, but it's a very good evidence-based treatment for both depression and anxiety, and it's something we use a lot as GPs in primary care.
Yeah, interesting. I always think about, we always worry about the past and the future, but the present's usually fine. Where we are right now is usually fine, but we always worry about what's happened or what's going to happen. And a lot of the time we spend so much time worrying about either, and we don't actually appreciate what we're doing right now. And I think that's huge. I think it's huge, and I think if people appreciated the present more and stopped worrying about what's going to happen, and a lot of the things that they worry about isn't even going to happen.
Yes.
Does that make sense? They worry about things that are not even going to happen.
Worrying is just praying for things that you don't want.
Exactly. Yeah, that's it.
And this is where mindfulness and meditation comes in. And this is something I've discovered really since the pandemic, really, when I was basically spending most every day and every evening indoors in my own house because you couldn't go anywhere or do anything. I kind of discovered meditation, and that is a tool to really help you refocus onto the present. And it's really been beneficial for me, actually. And I don't know if you guys have ever kind of played around with it.
I've never done it.
A little bit of mindfulness, It's interesting you bring it up because I was curious, because I know certainly I'm not immune to stresses and feeling down in the dumps on occasion. I'm sure you're not as well, Will. I was going to ask what sort of things you tend to do to kind of manage your own emotional well-being. Yeah, so
I'm here obviously as a health professional, but I'm also someone with lived experience of being a 39-year-old man in the year 2023. So I'm facing all the same stuff and the same pressures, and I get down sometimes. The world just feels like it's overwhelming, and I think what we all need, and what I've kind of built, is a little playbook of things that I know really help lift my mood and get me back on the straight and narrow. And the things that help me in my situation are, so we've talked about meditation. I try and meditate for say 5 to 10 minutes a day. It doesn't always happen, but it's for me, the value is I do that after the kids. I've got the kids down just before we have some dinner. It's like a natural window in the day. I'd love to be the person that gets up at like 5 a.m. These kind of thing people. I hate them. They always talk about, I'm up at 5 and I do my yoga and then I do my meditation and then I drink a pint of goji berries or whatever. I don't know. Parenthood doesn't really allow that because I get woken up at like 5 anyway with like knees and elbows in my face, and then there's like the curtains are coming down and day begins.
Yeah, I know that feeling.
So I've had to kind of adjust that. That is my. It's like with exercise, isn't it? I found a window that enables that. It's like a 5-minute window where I can actually have some kind of quiet, alone time, and I just sit there in silence in the garden. There's a night sky. I'll just contemplate that, and it's really just a moment for me to just stop and just pause and just be with my own thoughts. No screens, no other kind of stimulus coming at me, and then I just focus on my breath.
Yeah.
And it really grounds me and it brings you into the present. And I think the more you practice that, the more you can then bring that into the day to day. So moments when you're waiting for a bus, for example, instead of just checking your phone or ruminating over, I've got to organize all this stuff, and, you know, little bits, little kind of bittiness of day to day life is crowding your consciousness. And all that background noise, you just take a moment to just sit there, focus on the moment, notice the things around you. You kind of think, we're moving from winter into spring. I see there's leaves on the trees, and that lady's wearing a yellow dress, and I don't know. You're just tuning into the world around you. You're less in your own head, and you're more connected and present in the world. And that for me is a massive, massive boost to my well-being.
Yeah, my experience with that is not quite to that extreme, I guess, but for me, I find that if I don't allow myself the ability to process my thoughts throughout the day, it just disturbs my sleep so much. And I find that when I'm just on the go and I'm meeting to meeting, client to client, you know, home with the kids, you know, cooking, maybe get a bit of exercise in, like you say, on my phone constantly as well. I suddenly get down to bed, and suddenly that's when my mind goes, great, we got a moment to process, and the thoughts go, and I just cannot sleep. So I find that if I don't, like, it's basically daydreaming. If I don't daydream, allow myself a period of time in the day where I'm not on my phone, where I'm not doing anything, it just wrecks my sleep. So I need that in order to sleep well. So I think it is really useful.
So you're building in discretionary time where you can just think freely. You're not kind of task focused. You're not trying to process email or get the dishes done or pick the kids up from school. You're just time to think. I love that, Paul. That's something I'd like to have more time for as well.
And just weaving that in a little bit with exercise as well. Danny and I are kind of Brazilian Jiu-Jitsu fanatics, and I've pretty much been a lifetime martial artist. And one of our training partners talked about a Japanese word called Mushin, which is basically sort of free mind. And it's one of the really big benefits of Jiu-Jitsu is when you're on the mats,
nothing else matters.
You're just moving, and you know there's, by the nature of it, someone is normally attacking you, but it's in a sort of educational, friendly, controlled way. And it just allows you to move your body and just free a thought, and all you're thinking about is
you can't think of anything else. That's the issue with it, is because you are grappling, and you are there's so many levels to it, and it's so technical. You have no time to think about anything else. So that 1 hour a day, anyone struggling like with any sort of mental health, something like that, I can't emphasize. Like I said, I've done CrossFit before, and I love CrossFit. But it's not the same. As in, you cannot, when you do CrossFit, you still obviously you're knackered and you're going through the motions and you are doing your workout, and it does take your mind off it. But there's something about Brazilian Jiu-Jitsu that goes that extra level for like, I'm not a very stressful person anyway. Like in my nature, I'm just a bit more relaxed and stuff. But even me going into Brazilian Jiu-Jitsu, it's like, if I do it, I feel amazing all day. Feel amazing all day.
And I think there's definitely something to be said as well. We've touched on all this stuff already, but that sort of talking and sharing struggle. I think the shared struggle of jiu-jitsu as well. And you see it a lot in the military. You see it a lot in the military as well, where you form this bond with people because of the camaraderie, because of the shared struggle, the level of trust that you have because people are getting hold of your neck.
And you find out what people are made of. That's the big thing. On the mats, you'll find out people's personalities.
Yeah, you find out what you're made of as well. And I think through exercise and creating physical adversity, I think that dims down to some extent the struggle of life at times.
I'm a big fan of, like you guys, you found those things that get you into that place. And BJJ is not something I've ever got into, and martial arts generally, I just don't like being punched in the face. That's just not my thing.
Jiu-jitsu's for you then, my friend.
I'd love to try
There's
it.
no editing.
Okay, I'm putting in a chokehold, whatever it is. But I mean, there are, I think, an intense sport like that. For me, the equivalent would be competitive tennis. I find you get into the flow state, because you cannot think about anything other than the thing that you're in. You're so into it. And I'm quite a competitive person. I get really into matches.
I played air hockey with this guy.
I'm exactly the same in
streaming
tennis.
the place down, the ended up on top of the vending machine at one point.
What are we talking about? Like air hockey?
Things got really out of hand. It escalated quickly. But I get really into it, and I'm just but when you get into a competitive sports situation, I just find it keeps me so sharp. Like I'm so energized by it, but also it translates into other areas of your life. I just feel like I can be on my game with other stuff as well, because it trains your brain to focus on that thing and to really commit yourself. And so it's more than just well-being. I think it just sculpts you. It shapes your whole outlook and your whole approach, and the way that you attack the world when you do in every domain of your life. So I think for anyone, maybe BJJ, maybe tennis, maybe CrossFit, whatever you're into, find that thing that gives you that kind of level of intensity, that level of intense engagement, that flow state. Because it really is a powerful tool, isn't it?
Yeah, I think also you've got the skills acquisition. So the sort of learning something new as well. I think that really helps. And I think finally the social component of it as well.
Definitely. Yeah.
So you're there with people, and naturally on the mats, on the courts, off the courts, whatever, you'll chat to people. And I think where men in particular struggle, we've talked about this already, it's about not talking, and it's about keeping things bottled up. Yeah. And I think when you're in isolation, you're not around other men or like-minded people, you're more likely to do that. Yeah. I think when you're around people that you've just been through a bit of physical adversity with, you're more likely to just open up about certain things.
Yeah.
And I think just having those passing chats
definitely
will make a real impact, I think, on a lot of people.
CrossFit has a fantastic community.
Yeah.
CrossFit has probably... Jiu-Jitsu is pretty good as well.
Yeah, I think it's very similar in regard to that social component to it.
It becomes like a bit of a cult, doesn't it? But from the outside in, you see all the people in the gis and you think, a bit weird. The same with CrossFit, but
exactly.
Again, your CrossFit gym, I imagine you go to the same one.
It's a box.
Yeah, a box. Yeah. You go to the same box. Yeah, no, that's what they call it.
It's just an example of where the whole lexicon is different. And there's all this
they call it a box. Yeah.
But same with BJJ, there'll be loads of like little in words.
I don't want to call it a box because people wouldn't know what I was on about. But
I can't bring myself to say it. It just sounds so wanky.
No, but it is.
I hate that kind of term.
It is a box, isn't it?
Yeah. But again, these things kind of, I think from the outside, when you're looking at this stuff, you think, I'm not one of them. How can I be part of this? It gives it this kind of cultish kind of feel.
They are very inclusive people. I remember
when you get beneath that,
like a year, and some of those people, like you go over their house and train, and I think again you form that bond because you're going through struggle together. It's so extreme at times, isn't it? Some of those workouts, especially the open workouts, and you do it together, and you're just fucked, and you're just knackered. You just don't. And you form those bonds with people that you're struggling with.
Yeah.
I love it when we do a really intense workout and, everyone's, because the one thing at CrossFit, you're all doing that workout together. You're in your shared space. You're sharing that kind of pain, and you go
it's not easier
into
for
the
anyone,
pain cave.
Do you know what I mean? Across the board.
Yeah. But at the end of it, you finish, the clock stops and you just go around high-fiving each other. That sense of release and that you've been through this, like BJJ, you've shared that intense experience together in that same space. It's so like euphoric and powerful. And the social connection that you get from that, it's just it's really good.
It's good from
well-being and health.
It's so good from hobbyist to competitor. That's the thing. You can go from being a hobbyist and working your way up, and the more you put into it, the better you can get. And you can, not saying you can make a career out of it, but you can be competitive in it. And again, that for us as blokes is quite appealing.
Yeah, we need
because
that.
we have the masters and we have like things like that's what I quite like about Brazilian Jiu-Jitsu as well as CrossFit. In my head, I think I'm 33 now. In Jiu-Jitsu, I will only be fighting people in my bracket, even when I'm in 45, 50. Does that make sense? So my journey will always be against people that are the same sort of age and weight and all that type of stuff, which is appealing because, again, I come from football. I played football for a long time. By the time you're 30, you're virtually done. 35, you are done. Does that make sense? So
you like rugby, it's not a sport for life, unfortunately.
Exactly. Yeah. Whereas I quite like CrossFit, Jiu-Jitsu, stuff like that where we can do that after our football careers. You know what I mean? Like after we've played football up until we're 30, men get a little bit lost. I felt a little bit lost. That's why I tried CrossFit and now I'm into Jiu-Jitsu. But it's one of those ones where if I didn't find that, even now, I'd still go gym. And I like going gym and I like lifting weights, but it's not the same. It's not the same. It's quite a lonely thing. If you get into bodybuilding, if you're into powerlifting, all that type of stuff is great for you and it's fantastic. But it's not the same impact on your life.
The social piece is huge, definitely. And the other thing I wanted to say is, as a GP, I see older men and women, they're 60s, 70s, 80s, a lot. Some of them are in residential homes. Some of them are in nursing homes. They're being hoisted from bed to chair. And some of them are still living independently in their own homes, still gardening and going on package holidays to the Caribbean. The gulf in terms of function is just massive. Some of that is due to long-term conditions. Some of these individuals have got, say, chronic COPD. They've got joint problems. They've got other things that are holding them back, dementia, for example. But a large part of that is their just general physical conditioning. And I can really tell the difference between older people who have exercised throughout their adult lives and those that haven't. So if you're doing kind of functional fitness, strength training, endurance training, whatever it is, now in between 30 to 50, you're paying it forwards. And I think your risk of getting to older age and needing to walk with a Zimmer frame, needing to be hoisted from bed to chair, of just being very limited in what you can do is so much higher if you've allowed yourself to get deconditioned over that period. So this is a window of opportunity where your body's still physical, your body's still working and functioning. I think you've got to pay it forward. You've got to bank all of this now, because it will really make a difference in terms of what you can do when it really counts, then you're later down the line.
Yeah, that's so true. And sort of away from exercise, is there anything else that you do personally to kind of support your own emotional well-being? You mentioned about obviously the mindfulness. Anything else that you would recommend?
You mentioned this idea of processing your thoughts. And I know sometimes I get the same in the evening. If I've had a busy day, your head is just full of perhaps open loops, tasks you haven't quite completed, little worries about the day to come. I process those through writing a journal.
Okay.
I find that quite helpful, and so other people do this. So you just put your thoughts down on a bit of paper. You have a little book. I have a little keyboard. I have a digital journal. I find that a great way to process that. And just talking, and this is something I think the real key theme in this podcast is just, we've got to talk more. We need to just find people we can trust and confide in, and just have that, give ourselves permission to feel emotion, to share the difficulties that are going on in our life, because that is so powerful. So your partner, your spouse, whatever, just make time to sit down and hear what they've got to say. How was their day? What were the challenges for them? And then that's reciprocal. Then they can take time and talk about what's going on in your world. And I think just having a sounding board, or just expressing, getting those feelings out of you, is really, really therapeutic. So that really works for me. And the other thing I find, the final thing that is a big thing in my world, is this idea of play and creativity. And adulthood for me is very much a very serious place. We work a lot. We have a lot of responsibility. It can get all a bit austere. And I think if you can find certain things that you do that are just a bit silly, kind of, and just have a bit of fun, that really is so enriching. So for me, the kind of the little thing I do juggling on the side, in particular when we go to parks and stuff. Juggling.
To interject, the first time I ever met Will, we rocked up on a unicycle.
So it's just about, letting go and just...
while juggling? It's like a wild juggling.
That's the goal. That's a life goal. That's actually really hard.
Yeah, I can imagine.
Yeah. I'm working on it. I'll come back to you on that. But just having fun and finding something kind of creative and completely pointless. I mean, juggling achieves absolutely, juggling is not going to solve world famine, but that's also the brilliance of it. It's just something that's kind of so kind of unnecessary, but also so free and creative, that enables you to express yourself in a very kind of easy, contained way. Like the kids, I'll go to the park with the kids, they'll play on the swings for a bit. When I'm not kind of playing with them, rather than just sat there on my phone, I'll get my juggling rings out and I'll just throw them around. And that's cool. It's just an opportunity just to be a bit spontaneous, a bit free, a bit creative. So little things like that I try and cultivate. The other thing is I started to get back into music again, so playing a bit of guitar and stuff in the evenings. Instead of watching Netflix, I'm getting my guitar out and I'm trying to just record like Taylor Swift covers, whatever, rubbish.
Is it Taylor Swift? Is it that we're trying to cover?
Oh, yeah.
that's edit out. And anything he could have used, he's gone with.
I don't know why I went with Taylor Swift there. I was probably not the best call. She has got some great songs.
Can't backtrack there. It's on.
I have been learning Taylor Swift. I'm just going to put that out there.
Okay.
You deal with it what you will.
What song?
It was Blank Space.
Oh, it's a good song.
Yeah.
It's a good song.
Yeah, quite an apt title. I don't know what the lyrics were about, but yeah, good.
Yeah.
And I guess doing that type of stuff must be great with the kids as well, because this has been such a difficult challenge for me to overcome is not to use phones, electronic devices around my kid, because it's so easy just to remove yourself from their environment by doing that. And it's not something that they can really get involved in. And if they do, you've lost them. So I think something like juggling or whatever it might be, kicking a ball around, I think doing that with the kids,
it's really hard. It's really hard, especially as they get older.
Yeah.
It's really hard. Like, that's one thing that I was going to ask you earlier is what do you think the impact of phones is having on like men in their families, because I know me and my wife, we talk about it all the time. Like sometimes I'll be so busy, and obviously you can do a lot of work stuff on your phone. So I'm not like on my phone looking through Instagram, but I will be on my phone sorting out my clients, doing my programming, doing, my scheduling for the next week, my calendar, whatever it is. But I always, I get a lot of messages. I have a lot of clients. I get a lot of messages from people, and it does feel at times that I am on my phone a lot. And I know she says to me, "Danny, phone," and I know, but sometimes I do need to work. Yeah. But I think there is that impact of what you just said, being around your child and him being on a phone, or me being on a phone.
Yeah. But I think it's just anybody. Just when it comes to building relationships, whether it's with your children, which are obviously super important, but friends, anybody. When you're sat there on your phone, you're just telling that person. Sorry, Paul. But you're telling that person
just
that
got a message.
This everyone else is more important than me in your company, and I think it's a real issue. But it goes back to us talking about living in the moment as well. Yeah. And when you're living on your phone, you're just not. Totally. Yeah. And we talked earlier just off record about just, especially with like hybrid working and working from home now as well. Or from your phones, it's really important to have the ability to almost compartmentalize or just box off stuff and go, right, this is my work time, this is my home time. And I think that would be the advice that I would give to people who have that, is you just got to get to a point in the day where you're right, I'm done, phone's off, away, and that's it.
And I'm definitely guilty of that. I definitely...
we all are, mate.
I used to be really good at it. Like I used to be, like, if I didn't have an internet phone, I wouldn't even be on it. Like I went back to a 3310 at one point. Yeah. I actually went on eBay and bought like an old phone.
Yeah.
But then as my career has progressed and it's got busier and busier, I've just noticed it, and it just winds me up. Yeah. It just winds me up. But it's hard to get out of that.
Yeah.
Can I ask you both a question? Do you still have notifications on your phones?
Some.
So I have one on silent, but I have no notification come up on my screen.
Yeah.
So that makes sense.
So the most recent iPhone I've got, it has different modes on it.
Yeah.
So you got like a focus mode where you can basically shut off a lot of the notifications from certain apps and certain people, which is great.
Oh, is it?
Yeah.
Have I got that on my phone?
I've got the 13.
Yeah, I got the 13.
Yeah, I'll show you afterwards.
Nice.
So
that's
you
really
can,
good. Yeah, that's really good. I didn't know that.
Yeah. So if you're trying to do some deep work or just have some mindfulness, you can basically just shut it all off, and it still has. I think, for example, if my other half were to call me 2 consecutive times, it will notify me. So she knows that. So if it's an emergency, she calls me twiise, and I'll know. Yeah. So it's a good little.
You can also say people as a VIP contact, for example. Which is good. Because the struggle is real, and I struggle with this as well. It's just so pervasive.
It's going to get worse as well.
Yeah, exactly. And they're just like, their phones are just so. The dopamine pathways in your brain are fired constantly when you access your phone, because they're wired. All the programming comes from the gambling industry. It's designed. They want you. All the app developers want you to have maximum time on platform for advertising revenue. So they're designed to hook you in and keep you on the device, on the platform. And I think that you have to be very deliberate in how you engage with that device to hack that.
I think it's understanding that, though.
And the thing that...
how many people understand that?
Oh, exactly. This is the thing. There's a growing awareness that this is happening, and we are the product. We are being exploited by these other interests, and it's our attention is really their revenue. And we have to take back control. And I think for me, the thing that made the difference was just going cold turkey on notifications. So I 0 notifications.
So nothing would come up on your screen?
Nada. Everything off.
That's cool.
The whole thing. I just do not do notifications. And I just feel I've been this way for like the last 2 or 3 years. And it works for me because I therefore engage my phone in a more deliberate way. So it's
when you want to.
Yeah, exactly. So I batch check my phone. So I'll have a little check-in the morning where I go and I look at all the things that matter. And I'm deciding I'm going to go in, I'm going to have a look at my email, my WhatsApp messages, I look at the weather forecast, I look at BBC News, I look at my tasks. So I do that, and I have like a time-bound kind of time in the day when I do that, and then I'll check it again later in the day, like 11 a.m., check it again at 3 p.m., check it again at 4 p.m. But it's me getting my phone out, saying, right, I'm doing this on my phone. The kids aren't around. I've got a bit of space, privacy, and I'm just engaging that device in a very deliberate way. But in between that, and this, I'm not saying I manage this all the time. In between that, I try and pretend my phone doesn't exist. I just don't engage with it. And do you know what? Most things can just wait.
All of it can wait pretty much.
Yeah,
can it?
Exactly. It's rare that someone needs to speak to you this moment in time, and they can always ring you up. And I'm happy to answer a phone call because that doesn't happen that often. Most of the distraction is around stuff happening on badges on apps like Instagram, whatever, and emails and messages coming through. That is the biggest part of the distractibility, I think, of a phone. But turning your notification, going cold turkey notifications, that was a big thing, game changer for me.
I'll definitely give that a go.
Yeah,
definitely.
no, that's really good advice. And it's funny, as you were saying that, I was smiling because I noticed a while back on WhatsApp, I think when I was trying to set this up, I noticed on WhatsApp you've got a little message on there saying I only check this like 3 times a day.
Yeah.
There'll be a delay in coming back to you.
So I'm trying to manage other people's expectations, because some people do expect, they send a WhatsApp, they expect you to pick that up quite quickly. So there have been moments where I've missed stuff because I engage with WhatsApp differently to most people. Most people will get the little buzz in their pocket and they'll just check it straight away. Yeah. But I don't want that, like I'm with you. We've all got our phones off now. And isn't this great? Because we're all truly present with one another. Yeah. Isn't it the worst thing in a conversation where someone suddenly gets a buzz and even if they're still making eye contact, you've lost them. Yeah. And they're just thinking about what's happening there. That's that dopamine firing in their brain, thinking it's the variable reward of not knowing what that could be. Is it, if I just won the lottery? Or is that my wife telling me what's for dinner? I don't know. I can't wait to find out. And that's all I'm thinking about right now until I check my phone. But I've got to wait till you finish your sentence first. So just get on with it.
Yeah,
that is how it feels, doesn't it? When someone is in that mode. No.
Yeah, you're so right. It's so right what you're saying. That's so right.
Yeah, no, it's really good advice. So just to close out, I mean, it's been a great chat, but any kind of final tips for our potential audience in regards to just managing hectic lives and just making it all fit together?
I mean, we've covered loads of ground today. It's been really interesting. Thanks for having me on. And I just want to say what an honor it is to be your very first guest on this podcast. And I also want to say this is some really positive health messaging in here. There's so much dodgy stuff out there on the internet. So those of you watching, just be careful. Be very deliberate about what you consume. I think as a GP, as a health professional, and also as a 39-year-old man living in the year 2023, things are difficult. It's difficult to be a bloke in the world. There's so many pitfalls. There's so many challenges. But I think the key things that we've covered today, I think that the key, hopefully the key insights that I think you might choose to apply to your own life situation as men, I think are, first of all, building in activity into your day-to-day life, trying to live an active lifestyle, looking for opportunities to get moving, because that releases those endorphins. It keeps you fit. It reduces your future risk of heart disease, stroke, type 2 diabetes, obesity, the whole works. Movement is medicine. That is a really key message. Have a go at BJJ, CrossFit, competitive tennis. I don't know. Find a sport. Find some kind of outlet to channel all of that tension that the day and all that kind of builds up. The other thing is talking more. I think allowing yourself to feel negative emotion and finding an outlet for that, whether you do that through sport or whether you also process that through a journal or having a, what was it you did again, Paul?
Oh, just the daydreaming.
The daydreaming. If you're a daydreamer, maybe that works for you. That's a key theme.
If people applied this sort of stuff, it would really help their lives. And that's what I think we hope to get across to people.
Yeah, that's right. And I think a lot of the ideas that we've just talked about today might not be achievable in your life situation. We talked about all the structural barriers as well that are there. The way we want to live our lives, the kind of the well-being movement, what that aspires to isn't necessarily achievable with the structures and fabric of society as it is today. Yeah. So there's lots that needs to change to facilitate some of these habits and behaviors that will enable you to live healthier, happier lives. But just try and look for opportunities, little things in each day, ways that you can incrementally make things easier and you'll move in the right direction.
Amazing. Perfect.
Yeah, brilliant.
Right. Thanks, Will. Appreciate your time.
It's a pleasure.